Well, welcome to everyone. Welcome, good morning, good afternoon, good evening, wherever you are, and welcome to the Integrity Action and Accountability Research Centre webinar on resolving citizens' complaints, what makes it happen, who owns the process. I should say, first of all, that we are recording this. And so if you don't want to be recorded as having attended a webinar on resolving citizens' complaints, then probably now would be a good time to go. But we hope you don't, we hope you stay. And I should say a little bit about Integrity Action first, which is an international development NGO that works with citizens to monitor the delivery of vital projects and services where they live and to solve the problems that they find. And you should definitely go on their website because they've got some fantastic animation that shows that work they do really, really beautifully, very quickly. And the Accountability Research Centre, where I work, is an action research incubator based at American University. And at ARC, as we call ourselves, we bridge research and frontline perspectives to learn how to improve public accountability, working very much with what we call accountability frontliners, people on the front lines of accountability struggles. I'm Naomi Hussain, and we will be hearing today from a really excellent, really exciting panel of speakers. We're going to have Suchi Pandey, who is also from the Accountability Research Centre. She's going to be talking about our literature review that we've just completed for the Open Government Partnership on grievance redress mechanisms. We've got Annette Fisher and Tom Kirk, who are freelance practitioners and independent researchers, and they've been doing work on complaints mechanisms in South Sudan. And Derek Thorne from Integrity Action will be talking about this really fascinating study that they did on how people solve problems in development projects in several countries around the world. Isaac Otieno of the International Foundation for Electoral Systems will be speaking about the dynamics of solving problems in public services in Kenya. And Dina Balabanova, who is from the London School of Hygiene and Tropical Medicine and the Anti-Corruption Evidence Research Centre at SOAS, is going to be reflecting on how to take power into account in addressing absenteeism in public services in Bangladesh and Nigeria. So it's a really exciting lineup, you will all agree, and we're going to have a really good conversation. First of all, though, I wanted to say a few words about why we are so interested in complaints and how they get resolved. And one thing that occurs to me over and over again is that complaint is really everywhere. We complain all the time. People complain all the time around us. People are complaining about cuts in public services, about power cuts, police brutality, high taxes, bad roads, historical injustices, everything. There's COVID restrictions, of course, currently. There's complaints everywhere, protests are everywhere. And if complaints don't have a proper channel, if people don't feel that they can be heard and can have their problems resolved in a sensible way, they will take to the streets. And so there have been a huge number of mass protests, some really going to scale and even changing regimes in countries around the world in the last, well, in this 21st century. And you can go and have a look at Isabel Ortiz and Sarah Burke's new book on world protests, which gives you a sense of the kinds of issues people have been complaining about in the 21st century. And you'll see that complaint is a huge political issue. That's an open access book, by the way. I'll put the link in the chat. It seems clear to me, as someone who studies accountability issues, that people complain because actually they feel they have a right to something better or something different, and that public authorities, whoever they might be, are responsible in some sense for addressing those complaints. I think that's really a crucial thing to think about. I hope we can have some conversations about this today, about the sense that people have a right to complain, they have a right to resolution of their complaints. And the other interesting thing that we're learning is that many governments around the world, all around the world, and this is not only because aid agencies or the World Bank require them to, but many of them have been setting up grievance redress mechanisms of a range of varieties and types and quality. And these are designed to both collect and respond to people's complaints, mostly about specific programs and projects, rarely about broader policies and other aspects of governance, mostly about programs and projects. And Suchi Pandey will be talking about the review of the literature that we did that looked at this rise of grievance redress mechanisms. At least on paper, there's been a huge rise in them. But our literature review suggests that while there are many, many of these mechanisms, we don't actually have much evidence of how, or indeed if, they actually work to resolve citizens' complaints. We really don't know very much yet. And so I was having a most unusual positive conversation on Twitter with Derek Thorne about their really interesting research on how people were resolving problems, even though they didn't use the language of complaint or grievance in that research. It's very clear that they had done this really excellent research on how people with organizations in support with their own civil society groups or community-based organizations with local governments managed to come together in different ways to resolve the problems that they face in public services or projects. So Derek and I thought it'd be a great idea to get together some practitioners and researchers who are thinking about these issues, trying to figure out how citizen complaints get resolved, and to learn from what we're all learning around the world. So this discussion is going to use what we call the lightning talks format, which means that the speakers can tell you a little bit more about their backgrounds if they would like to in their 9 minutes, is it 8 or 9? It's not very many minutes anyway, but or we can direct you to their bio so you can look up their backgrounds for yourselves. And now we are going to get started. I should say, we've got a poll. We just want a quick poll just to get a sense of where you are, if that's all right. There's a couple of questions that will be popping up somewhere. There we are. So please fill those in if you can. And we will be taking questions in the Q&A box. So you can feel free to put those in the box whenever you feel like, and I will, with my privilege as moderator, select which ones to answer. I'm going to now hand over to Suchi to start us off with her lessons, key findings from the evidence review on research into social audits and grievance redress mechanisms. So over to you now, Suchi.
Thanks very much, Naomi. Good morning, good afternoon, good evening to everyone. Thanks so much for joining this webinar. I'm going to talk to you very briefly about some preliminary thoughts from our ongoing research on grievance redress mechanisms. Really, for us, GRMs are a form of institutionalized process or practice to ensure citizens are able to complain either to providers, to public agents, or project officers. But for us, GRMs are not just about technical design or information flows, but more importantly, they are also about power relations, by which we mean that citizens are empowered to make claims on public agents who in turn should be empowered to appropriately respond to and redress those complaints. So redressal is a key point in grievance redress mechanisms. What got us interested in this research was, apart from our individual interests in citizens' protests and citizen-state relations, was that we were finding that GRMs are increasingly widespread and notable feature of international development, as many of you know. They're expected to have significant potential to improve projects and services, and they have the potential to improve accountability, especially for excluded and marginalized groups that tend to get left out of decision-making and governance processes. So what are we finding very quickly? So we find that GRMs are increasingly widespread and have been increasingly becoming popular in the last 20 years. So very quickly, to give you an idea, we did, for this review, we used Google Scholar as one way to kind of access, published academic literature on the topic. And we found that it was really in the early 2000s that the term started to appear in scholarship and gray literature. And this corresponded, as many of you would know, with the rise in demands for responsive open governments and the new accountability turn and the introduction in many countries of the new public management strategies, where more and more public services were either being contracted out to private actors or third-party implementers. But in our review, the one thing that stood out to us was that despite this uptake and this increasingly widespread use of the term, there is little clarity on what we mean by GRMs and what they are intended to do. For us, what is important and what sets the grievance redress mechanism apart from claims making or accountability demanding or some kind of feedback mechanism is the redressal or state responsive aspect of the GRM. It is very important when you file a complaint, that your expectation to get redress is met. And we're finding that the literature on the redressal is quite thin. So what did we find? There is more attention on designing GRMs and on registering complaints than there is on resolving them. The research on the nature, the rates of resolution, the number of complaints is quite thin. Also, the literature that we did review is geographically and sectorally quite uneven. We also found that the focus on the role of civil society or the role of independent third-party actors in helping excluded groups or citizens access or navigate the grievance redress mechanism is quite low. We did, though, find some exceptions in South Asia and in some African countries, and you will hear from Derek and Isaac here today on some of those experiences that Integrity Action has documented. We also did find that there are varying goals and motivations for governments who are very keen to take up or institute or establish grievance redress mechanisms. But because there is not enough research on what these exact motivations are, from the literature, we were able to infer 6. So for instance, most likely a GRM will be in place because a law or a policy or a loan or a donor organization requires it. There might be reform-minded political leadership that's interested in open government, in responsive governance, and that might be one of the drivers. There might be, and this is leading from the new public management approach, an interest in improving internal organizational efficiency and effectiveness of public agencies that are still delivering services. There is also a contradictory motivation on the one hand of enabling systematic listening to improve policies, but on the other hand, there is the fear that it might also be used as a surveillance tool on citizens' perceptions of government. The 5th is that governments, by illustrating to citizens that they are interested in hearing their concerns, might be more oriented towards enhancing government legitimacy in the eyes of citizens. And the 6th is the protection and promotion of citizens' rights that governments are interested in upholding. We did not find enough in our review, we did not find enough evidence on this, but for us, as we were going through the literature and in our conversations with some of the people who are involved in this work on the ground, we were finding that anonymity is a key issue, especially for marginalized and excluded groups who want to complain and oftentimes face a huge personal risk in trying to register a complaint and to seek redress through the grievance redress mechanism. So based on our review, what we are trying to do right now, and this is still very much a work in progress, is develop what would a good and effective GRM look like. And we outlined 3 key elements. So the first element that we think is important is citizen capacity. So by which we mean that the citizens should know their rights, be aware of the grievance redress mechanism, have some kind of assistance through third-party actors to access and register complaints, and have help in follow-up with redress. But more importantly, there should be they should have a time-bound response, and they should be able to complain freely without threat of reprisals. On the state capacity, the second element, we think that there should be, the state should facilitate registration, but also track and monitor how these complaints in particular sectors, in particular regions are doing. But they should also have the independence, the grievance redress mechanisms, the officials, the human resources that are in charge of handling complaints should have enough independence to resolve and, importantly, enforce their resolution. Because as I said, a key component that distinguishes GRMs from other forms of accountability making, claims making, feedback mechanism is the redressal aspect of it. And most importantly, where there are information exchanges based on complaints received between agencies, the commitment to anonymity must be upheld when you transfer a complaint from one to another agency. And lastly, there is the element of proactive transparency about complaints. As I noted earlier, what we found in this review was the number, nature, and the rates of resolution. The research on this is extremely thin. We did not find enough empirical evidence on these. So what would a proactive approach to transparency about complaints look like? First of all, the number, nature, and progress on complaints should be accessible. It should be tracked, and so that both it could activate civic actors to follow up and institute and demand policy changes, but also organizationally for governments to boost morale and to remedy problem hotspots or reward good practices where they do find them. And this will only happen when you are able to track and monitor the complaints that are being received and the kinds of resolutions that are being offered. And finally, this is something that we found in a lot of complaints around social protection programs globally, was that a large number of what are called, or what we're calling, unentertained complaints, where you think you're entitled to a service, but because you are not, quote unquote, a beneficiary, your complaint does not get registered. So unentertained complaints need to be recognized, and more importantly, they need to be redirected to concerned authorities. I want to stop here, and I'm happy to answer more questions in the Q&A session. Really, what is driving our interest, and I'll just end with 3 or 4 research questions that we're really trying to explore further, is what are, because of the key interests in GRMs globally that we're finding, we would like to know more about what are governments hoping to achieve when they establish GRMs, how and under what conditions do GRMs function effectively, and what are the technical design features of those, and under what conditions have GRMs provided policy feedback to improve the policy design or address systemic level issues, and what role does organized civil society play in co-designing and activating GRMs. Thank you.
Thank you so much, Suchi. That was a brilliant summary of many, many months of hard work, as I know very well. And some really key points there, I think, about the fact that how and whether governments resolve citizens' complaints really depends a great deal on what government's motivations for setting them up are in the first place. So if the point is not to resolve complaints, then they are unlikely to do so. And also these 3 important dimensions of grievance redress mechanisms that work: citizens' capacities to complain, state capacities to respond, and proactive transparency of the process. I think all very important issues to keep in mind. And I'm now handing over to Annette and Tom, and your 9 minutes start now. Thank you.
Thanks very much, Naomi. I think we've got some slides that are being put up. But I'm going to kick off while they hopefully get put up in the background. In the meantime, hopefully I can actually share the ones if they're not going to get put up there. Let's start with that. There we go. Okay, so can those be seen? I just want to check. Sorry, because I didn't know I was going to be the one sharing the slides.
Yes.
Great, that's wonderful. Thanks. Okay, well, thank you very much for inviting us. So just to get straight into it, a little bit of background before we talk about the main area that we wanted to share with you here. So over the last few years, I've been supporting UNICEF in a kind of global level on strengthening their work on social accountability. And through that, UNICEF South Sudan approached Tom and I and asked us to design a grievance redress mechanism for them for their health project in South Sudan. That's just to sort of explain why we're talking about what we're talking about. And there's a few details on the screen there about how the program works. So it's only in 2 states in South Sudan. It's funded by the World Bank, and it covers a large number of people across a lot of health facilities. The system has been designed for UNICEF and their partners, their implementing partners, as the people who are delivering the services and thus are the duty bearers of the grievance redress mechanism. But what makes this one unique for a humanitarian delivery system of aid and a complaints mechanism linked to it is the intention is that eventually the government of South Sudan will take over the delivery of healthcare in this area and other areas of South Sudan, and so would eventually become the duty bearers responsible for responding to the complaints that would come through the system. So it's not a system designed exclusively for humanitarian actors. It's not a system designed in a state citizen situation. It's a system that, as I said in the first slide, needs to evolve from one to another. And Tom's going to talk a little bit about what aspects of the system are odd as a result of it needing to do that. In South Sudan, the government has created something they call the Boma Health Initiative. This consists of sort of two streams. One is what they call the Boma Health Workers, and these are community health workers who deliver services alongside services delivered at traditional health facilities. And then you have something called the Boma Health Committees, and the job of these is like health committees in many countries to facilitate communication between service users and service deliverers, and to, where possible, monitor the delivery of services and to report upon problems and issues. When we first started this piece of work, we conducted research to understand the barriers to people using a GRM system in healthcare in the two states. The barriers were multitudes, but the ones that are important for what Tom's going to talk about are those relating to women and marginalized communities feeling very nervous and apprehensive about revealing themselves as complainants and engaging in a system where potentially the state and service deliverers and those in power would be able to know that they had made complaints against them. Security issues related to ongoing conflict problems in which are different in the different states. A hierarchical, patriarchal, and what we're calling collective culture around the way in which communities talk about issues and the way in which communities do or do not permit complaints to take place. So that was a very much a barrier that was revealed in the research. Very little culture of complaining against service deliverers, whether they be governments or humanitarian actors, and thus a very little experience of what engaging in a GRM might look like. And as might be expected, in remote rural areas, digital and transport access issues, probably some of the most acute that I'd ever come across in working on this kind of thing. All of those were things that the system needed to deal with, as well as be able to actually function and provide an avenue for communication for people who were receiving these health services. In addition, because this was a system being designed for UNICEF delivery, it needed to comply with UNICEF's corruption and preventing sexual exploitation and assault protocols, which are very specific and have very specific ways in which UNICEF require complaints around those issues to come in, as you might expect from a large international actor. And Tom will talk a little bit more about how our system was designed to cope with that. So hopefully that's enough information, but do feel free to ask more in the Q&A if you'd like to know more. So just to say before I hand over to Tom for him to explain how the system worked, we basically were designing a system to sit in two contexts, as it were. Firstly, to sit in a context of humanitarian service delivery. And this is for those who are not familiar with the humanitarian sort of context. This is what the humanitarian actors called accountability to affected populations. And this is somewhat new within the humanitarian space in terms of a accepting of and articulation of the need to provide accountability to affected populations to people. And it was obviously also being designed, as I mentioned, to evolve into a situation where you would have a social accountability relationship between government service providers and citizens. Those are two very different contexts in which a GRM exists, and so therefore it was a very unusual system that was being designed, and Tom's going to talk more about that now.
Yeah, to follow up from Annette, in a way, our system was kind of designed to sit somewhere on what people call the development humanitarian nexus. South Sudan, for the most part, is a humanitarian situation with kind of aspirations to move into more development kind of programming. I think most of the agencies there are looking for that. So in a way, you could say our system was about setting up those conditions to move from AAP to social accountability and embryonic governance, citizen-state relationships. So what is the system that we ended up deciding to do? Based on our research, we decided the system had to be able to collect and analyze both feedback and complaints. And we kind of conceptualized feedback as people giving their opinion about service and how it was delivered, whereas the complaint is when the service deliverer has somehow contravened or gone against their obligations, either in law or other obligations or promises they've made. we had to enable the more vulnerable citizens to be able to access the system and raise their issues and give their feedback and complaints. That included people who were perhaps of groups that were being persecuted for whatever reason by local public authorities from the state or elsewhere, and then women and children and people with disabilities or other needs. Part of that was anonymity. Many people really, sometimes a context where people's identities and knowing who's complained about who could lead to quite violent outcomes if not done safely. As Annette said, UNICEF's policies on sexual exploitation, corruption, child safeguarding are pretty strict, but they do make some challenges for a complaint system. Essentially, they don't want any of these complaints handled by the system. So we had to have strict protocols where, should any of these issues be raised, they can exit the system and go all the way up to a national level for UNICEF. So that was pretty tough for us to build in there, because people are going to see a complaint system and want to complain about these things naturally, because they do occur within the context of health service provision in South Sudan. We also had to think about what South Sudan had committed to in terms of providing health services, and it's also committed to allowing citizens channels to talk and give their opinion and raise, even though they don't use the language, but raise complaints about the provision of health services. And part of that was baked into the South Sudan's Boma Health Initiative. And then lastly, we really wanted to our system to what we call strengthen social accountability relationships, which is really, it's more than just about people complaining and then having some kind of response, but also about citizens and public authorities, be they humanitarians or state actors, get to know one each other, get to share problems, and get to come up with solutions together to strengthen those kind of relationships. I guess it's the beginnings of a social contract in some sense. Next slide, please. Next slide, please. Thank you. Oh, back one. So I'm going to talk about the 5 streams that we decided to build into the system. We spent a long time deliberating how we could live up to all the aspirations we had, and we decided that the multiple streams for raising feedback and complaints was the way forward. The first stream, you can go to the next slide, please. The streams are represented by the colours in the diagram. The first stream, if you see the green arrows, concerns citizens going to what are called the Boma Health Committees or Boma Health Councils. They're essentially committees of locally influential public authorities, chieftains, women's and men's leaders, youth leaders, teachers, religious leaders, who are responsible for being the kind of bridge or the mediator between service providers, in this case health service providers, and citizens, and meet with the service providers. So we trained people on those councils to be able to handle complaints sensitively and then feed them either directly into the health services, the health facilities, or up to the implementing partners that were implementing this UNICEF health project. We wanted them to be able to bypass the services altogether if the complaints were about the services themselves and go straight to the partners. Within those health councils, we also trained what we're calling a women's AAP champion. They were trained to particularly deal with issues related to children and to women, and they had, again, multiple ways where they could either...
Tom, I'm going to have to ask you to speed it up. You're already at time.
Okay, sure. Where they could either bypass services or go straight in. Just talking a little bit about our desire to move from AAP to social accountability, it was really important to us that even though this system is taking place to UNICEF, eventually it will take it to the government when they start being responsible for health provision. At the national level and at the state level, the data that the complaint system is producing was, where possible, with a lot of redactions shared with government actors, because we also began to find quite early that people wanted to take those complaints to government actors at the same time. However, in a place like South Sudan, you've got a problem where there are some areas are opposition areas and some areas are government areas, and people have different levels of trust for different public authorities. So that's kind of a tension that runs through this kind of move from AAP to more social accountability and the grievance redress. And then what else? So that's where we're at now. Next slide, please.
That's it, Tom.
Oh, the data slides. Never mind. Okay.
Thank you very much. Thank you, Annette and Tom. We will have a chance to talk some more. And if you have a link to that report, I think many people would like to have another look at your interesting infographic. That does sound like really fascinating, very, very challenging work. And you bring up some really important issues of trust in local authorities, trust in government, trust in the mechanisms. And I think these are really crucial questions that we need to explore further. And now I'm going to hand over to Derek Thorne, and he's going to talk to us about the research they've been doing in integrity action. Your 9 minutes start.
Thank you, Naomi. I'll just share screen now. And great to hear trust there. Trust will be featuring in this one as well. So let me kick off. What I'm going to be talking about is a piece of research which Naomi mentioned just at the beginning. It was looking into what factors lead to resolution when citizens raise problems with public services. And we're drawing on a piece of research which was carried out by ECRIS and which we published in July of this year, Solving Problems in Public Service Delivery. The link for that should be appearing in the chat around now, but please do check it out at some point. So basically, what we're doing here is studying a citizen monitoring process. That's what the research was doing. And the citizen monitoring process is one that's carried out by Integrity Action and its partners. In this research, it was in 3 countries, Afghanistan, Palestine, and Kenya. And just to quickly explain what that process involves, there are citizen monitors who are recruited from the community, and they are looking at particular projects or services happening in their community. They're doing 3 fundamental things with those. They're accessing information, so they're finding out exactly what they're promised, what they are entitled to from those projects or services. They're monitoring them, so that means they're physically going to these places. It could be a construction site, it could be a health centre or a school, and they're recording the problems that they see and the performance that they see. And in many cases with Integrity Action, they're using a digital tool to do that. We designed a citizen monitoring tool called Development Check, which does that. And then the third thing they're doing is constructively engaging with the relevant duty bearers to try and resolve the problems and get to the resolution to the problems that they have identified. And we've talked in this webinar already about complaints, and Tom there was talking about sort of how you view feedback and complaints, for example. We use the term problems. So in our methodology, a problem is a promise that has not been delivered on. So for example, if a construction requires in the contract that a certain quality of bricks is used, and in fact the monitors notice that it's not that quality, then they can register a problem. And then through that constructive engagement and perhaps other processes, they can find a solution to that. And of course, here it's the monitors who are choosing when the solution has been reached. And it's not simply the solution has been pledged, it needs to have been implemented, and they see that and find evidence for that. Just a couple of things to mention about this that relate to points in the webinar. So we're asking, who owns the process? Well, here clearly this is not a GRM, a grievance redress mechanism, in the sense of the government setting up a mechanism to hear citizens' complaints. This is something that's been set up and established by civil society independently. Of course, it is ultimately not done in a vacuum. It does have to be done with the buy-in of the government as well. But still, that does allow us to set up and model a process which is potentially more inclusive, more collaborative, and by our measures, more effective than what exists already. And through doing that, that has allowed us to demonstrate that to government and then to try and influence what existing processes government has after that has been modeled effectively. So it kind of makes that conversation easier in our experience. So anyway, back to the research itself. So what the research did was took 16 projects or services that were being monitored in those 3 countries, Afghanistan, Kenya, and Palestine. And then with each one, it looked at 2 problem-solving processes, one of which didn't work out with a resolution and one of which did. So we've got 32 problem-solving processes, half of which reached resolution, half of which didn't. And then the researchers used qualitative comparative analysis to work out which factors were most influencing resolution and also what pathways were catalyzed through that. Here are the factors that they looked at. So there's a couple of, I don't have the time to go through these in detail, but at the top there's a couple that are to do with the supply side. So the financial resources that are available, and the human capacity of the duty bearers. Governance mechanisms is in there, so that's like platforms for dialogue, for example. Trust comes in, of course, as well as more practical collaboration. There's 3 on incentives for the duty bearers themselves. There's 2 there which are to do with the type of citizen-led action. So was it informed? Did they have the relevant information at their fingertips? And was it intense or frequent? And then the last one, issues with subcontractor. Big reason why that's there is because a lot of the projects that were included in this study were infrastructure projects, so local infrastructure being done in communities. So let's have a look. Basically, there were 2 pathways that were found to be most associated with successful resolution of problems. Here's the first one. So there were 2 key factors within this pathway that were catalyzing the resolution in the end. So firstly, there was access to accurate information, and secondly, the human capacity of the duty bearers. Those things helped bring about mutual trust, which then brought about more practical collaboration. And then the presence of governance mechanisms was also very useful. Let's have a look at a quick example. So this is a screenshot from Development Check. That's the digital monitoring tool I talked about. And Development Check publishes all of the monitoring data and photos in real time. So you can go and look at that afterwards if you wish. This particular project was a construction of an early child development center. And what the monitors found was that the roofing materials being used were of substandard quality. They knew that because they had the information on what had been promised. And so they were then able to work with the duty bearer, who had sufficient capacity to work with them and engage with the problem. And then they were able to use a governance mechanism, which was like a collaborative meeting, to be able to solve the problem. So let's look at the second pathway. This one also had human capacity of the duty bearer in it. So that was clearly coming through as important. But the other thing was mutual trust. So that one was catalyzing collaboration, kind of like we saw earlier. Governance mechanisms were also playing a role here. Access to information was also playing a role, but then there was also social incentives present in this one. All of that was leading to problem resolution. And just very quickly, an example of this pathway was from the school in Afghanistan, where some dirty toilets were identified by some student monitors. And they framed the problem in a way that really emphasized the risk of disease to the student body and so on. And that meant that there was more impetus for a solution, and particularly seemed to attach this kind of social benefit to, for the community for solving that problem. A few points that have come out from these as well. So when it comes to building trust, something we saw particularly in Kenya was that very localized duty bearers were really helpful with that. So there's due to devolution, there's a class of duty bearer there called the village administrator. Kwale County, where this study was done, does have village administrators and has devolved to that level. And those people were sometimes from this very same community. So they already had quite a good relationship with the monitors potentially. Also, what we saw was that those duty bearers didn't necessarily have direct responsibility for the project that was being monitored. And so that meant that they could actually become allies of the monitors rather than feeling like they were under pressure about it. So in a sense, they were almost joining forces in a kind of collective action to then pressure the person who was most directly responsible, which is of course the subcontractor in the case of an infrastructure project. And then in the cases where there wasn't those localized duty bearers, these collaborative meetings, which may already exist, but if not, was something that we were setting up as part of the approach and that we sometimes call joint working groups, those regular collaborative meetings that bring in community members and monitors and duty bearers, they were also effective for building trust and also functioned as governance mechanisms for dialogue when such mechanisms didn't already exist. So just a few final points. The financial resources factor was not seen to be as important as the human capacity of the duty bearers. And that was perhaps a slight surprise for us at the beginning of this. However, one key reason I think might be that the majority of the projects were infrastructure projects. And in those cases, the payments to the subcontractors largely had already taken place by the time these problems were being identified. So the money was there, it's just the sort of implementation of the contract wasn't. However, we also, the research also did find that the more complex the problem was, the more important financial resources became. And then finally, the other thing was to do with the role of citizen monitors. Quite simply, the research found that they played a critical role in making sure that all of those problems did get solved. So For example, they were investigating the problems, drilling down to root causes, following up, sometimes repeatedly, and also overcoming confrontation and bringing about a more collaborative mode of dialogue. So I think that's about the 9 minutes. Thanks for listening, and I look forward to the discussion later.
Perfectly timed as well. Thank you, Derek, and really enjoy your infographics. Not being one for those myself, I actually found yours really easy to understand and really helpful. That's a fascinating piece of research, and again, trust comes up. But I think the way you've put together in much more granular form the pathways through which problems are resolved or not resolved, the blockages and so on, I think is really interesting. And I think we have lots more to do on this. I think it's great. And now I'm going to turn over to Isaac Otieno, who's going to talk to us about the experience with public service problem resolution in Kenya. So Isaac, your 9 minutes start now.
Thank you very much. I pick it up from where Derek has left it, which is from the study that I was part of, looking at demand-driven citizens for services that were entitled to them by the government of Kenya at devolved government level. This was a civil society-driven accountability kind of study, trying to find out how communities in that county were demanding for, if you like, their rights and entitlement and better service delivery. So it was a very important study, and this follows up from what Derek shared. I'm going to focus more on the nuances that came out of that particular study with regard to what public service institutions or structures ought to be doing and how they interact with the citizens. So out of this study for the project that Integrity Action was working very closely with the civil society organizations in Kwale County, what we found out from the research that we conducted, that the key driver of change between the two parties, the duty bearers and claim holders, was freedom of information played a very important role. The fact that the community members had access to information about the project, the budget of the project, that the monies allocated for it, and sometimes the technical specifications that were needed. Was the roof to be roofed with hardwood or softwood? Or was a toilet pit latrine to be constructed? How deep, how wide? Was power to be installed in a particular school? How soon and by who? Those kind of information was very important. It helps that in Kenya there's a Freedom of Information Act, so the citizens were able to write on the fact that there exists legal provision for them to access that particular information. The second lesson that came out of it from the data we were able to abstract was the fact that there's a constitutional and legal framework that allows for effective, meaningful, and informed public participation. The fact that the law, Kenyan Constitution, and the attendant statute provide for meaningful, informed public participation did help, because then the community members were able to come up with structured arrangement and structured framework in which they were able to engage the duty bearer when these problems that were to be solved needed to be addressed. And the duty bearer was then duty bound to provide this information in a timely quantity and in a language and manner in which the community members could were able to absorb, understand, and then be able to resolve that particular problem. So it is important that the law and the constitution entrenches this kind of thing. The other important factor that came out is the institutional framework. The institutional framework that brings together both the community members and the public service institutions that deliver these public services is very important. The community members were able to organize themselves, for instance, in project implementation committees, project management committees. The structures allows for discussion, a space for discussion, a space for accountability, and a space for people to know exactly what the duty bearer is supposed to deliver, and the claim holder also to know what exactly their responsibility are. So what we found interesting is that these structures were very well organized, they were predictable, they are well coordinated, and then they were able to engage with the duty bearer as it were. The other aspect that we found that was interesting is in Kenya, we have devolved government systems, so national government, and we have devolved government system. So this demand from the claim holders are coming out of the context of devolved government county level. So resources that are channeled through devolved government systems allows for services to be devolved at very local level, depending on how citizens themselves have prioritized services. One of the services that we monitored or evaluated, as it were mostly early childhood school education. Most of the projects were around early school childhood education, for renovation of classrooms, which are the duties and responsibility of the devolved government. So what we found out is that devolution as a structure of government, as a system of governance that allows for access to resources, that allows for citizens at the lowest unit to access services, does work. And that seemed to have been a motivator also for the projects whose problems were resolved in the county that we were reviewing, whether such problems were resolved or otherwise. So we found that works very well. The other aspect is the nuance of rights-based approach, that the people are aware of their rights. Community members are aware of their rights, and they know that they are claim holders, and they're able to assert their rights and demand for services from the duty bearer, from government, as it were. So they use right-based approach in the engagement in the spaces in which they have created, be it project management committee or project implementation committee, or using the information from the monitors who are on the ground. And these monitors are recruited from amongst themselves. That they help them to then assert and document that right that was being denied to them on service, and use that to assert for their rights. The other point was really the issue of human capacity, which was in the form of the monitors. The monitors played an extremely critical role in trying to get accurate and timely, well-documented information. This information will be validated by the community members and will be packaged and shared with the duty bearer in a way that then compelled the duty bearer to respond to it. And there was a very structured way of interplay between the duty bearer, the monitors who are the brokers and the holders of this very important key of information, and also collaborating very closely with the community members. So lastly, as I come to an end of the presentation, one of the things that came out also was just the tension between representative democracy, discursive democracy, and emergent right-based approach to development. In our work, people did not refer too much, or they didn't even talk about their representative, who have a role to oversight funding that goes down to them for services to be delivered. What the citizens or community members do, they have created platforms from which they're able to engage, negotiate for power, negotiate for space, and demand for accountability and transparency. If you like, tension between representative democracy and open government. So we are beginning to see a shift, a gradual shift from open governance to, from representative governance to open governance, which is citizen-driven. So I'll stop there, and I think my 9 minutes are up. Thank you.
Thank you so much, Isaac. There's so much there to discuss further. Sorry, whoever's got their mic on, if they could. Yeah, thank you. Thank you so much, Isaac. I mean, I think particularly you picked up some really interesting questions there about the extent to which a constitutional legal framework for citizens to give feedback and get response is really crucial. And these questions you raise about spaces for accountability, and I think the examples that you give all suggest something that Suchi and I have been puzzling over, which is why are so many grievance redress mechanisms designed as individual complaints platforms when actually what we see is effective feedback really does come in through collective action and collective information sharing and collective rights-based approaches to problem solving. So that's really fascinating insights from Kenya. Thank you, Isaac. And now I'm going to hand over to Dina Balabanova to talk about absenteeism in Nigeria and Bangladesh. So your 9 minutes start now. Thank you.
Thank you very much for, do you see my slide? I presume, yes? Do you see my slide? Okay, thank you very much. Thank you very much for inviting me. It's a fascinating discussion. And I think in our work in the ACE consortium, which is the Anti-Corruption Evidence Consortium, we've been trying to connect to people who work in generally in development studies and social protection, other disciplines, and in health, we have a slightly different debate. So today I'm going to focus a little bit and bring some country evidence on what do we do about claims? How do we make it actually happen once the claim is made? I'm going to present work which was done in the scope of this consortium, and our main focus was to really go beyond simplistic solutions, to think about the political drivers, the political settlement in a community, and what drives corrupt and rule-breaking behavior. Our logic is that you need to understand the political drivers in order to design feasible strategies that could be implemented. Because we have in health, a lot of solutions have been proposed, but we end up not able to implement them. And we have very poor experience, as I'm going to talk in a minute. So first of all, we try to think about different forms of corruption, and our work showed that absenteeism came as one of the most persistent problems in health systems everywhere. So many of you may ask, is absenteeism corruption? So I'm just quickly showing for completeness this definition. We have slightly expanded the usual definition. We are saying that anything that diverts institutions from delivering their core aims, and their core aims could be expanding access, ensuring equity, and absenteeism is really something that does that. I would like to argue that absenteeism is not a fault of individuals. That's not the way we address it, but thinking about how do we take into account institutional capacity, balance of power. So once you have the claim, what can you actually do? So first of all, just a very quick one for completeness, and you'll probably get the slides, but absenteeism is often seen as a minor problem, while we would argue is the opposite. Absenteeism is the main stumbling block in operation of health systems. It's everywhere. It reduces access to key resources. It's regressive. It is undermining trust. And also we see it very clearly linked to political factors as opposed to retention, which is often linked to people just wanting to better their career and being somewhere else. And we see the situation exacerbating during COVID and persisting. So I'm just, for completeness, I'm showing this slide, but there is a lot of research, and we've done a lot of literature reviews trying to identify what are the different drivers of absenteeism. And this is nothing new. So we know it's dysfunctional systems and scarce resources and lack of enforcement and mechanisms for redress. But what we also emphasize in our research that sometimes rule breaking can be problem solving. So if there are not enough staff members recruited or in place, you may want to close your eyes for absenteeism because you don't want to alienate those who are there. So there is a complexity here that we need to take into account when we think of how we act on complaints. We have also the social factors, which are people leave their jobs in order to fulfill family and social obligations. And then one area that I would like to talk today about is the political environment, the political drivers of absenteeism. What is it that prevents we acting on absenteeism, even if we have information that it's happening, people have reported it, and I would like to turn my attention to that very briefly. So internationally, if you go and Google and look at various papers, how do you tackle absenteeism? You're going to come up with mainly suggestions such as monitoring, transparency measures. A lot of countries are implementing biometric or community monitoring, complaints mechanism, as we talked today, and these have been actually successful. So we have a lot of places where these things work and people know who is in place. Everybody would tell you, this person is not in place ever, or this person is intermittent or leaves early. So again, but we don't see the success, we don't see the impact. And our question really in our program in the past several years has been to understand why. And I would say that some of the important things that we need to look at, that how do we fit with the governance structures in the health system? How do we manage informality, what people do, the negotiations that they enter, which I'm going to talk about, and the political drivers. So let me give you several short examples. So what we did in Bangladesh, we actually decided to go and ask the doctors to see why are they leaving, absenteeism, not retention, they are different phenomena. And we did a discrete choice experiment. I'm just showing you the tool we used. We offered them different aspects of the job. And we said, would you take this job if you have a mix of some of these attributes? For example, you could have career advancement, you could have a bit of money, but they're all mixed up in different combinations. So they couldn't game it. So that's the purpose of the discrete choice experiment. And we did that in rural Bangladesh. We also included supportive community, relationship with the community, money, opportunity to advance your career, to be transferred. And what happened was really surprising to us. We didn't expect that. We expected them to go for the money, to choose or to be transferred, or to really find a place where they can receive training. That's not what we saw. What people reported is they'll take a job where there is supportive relationship with the community. So that was a really strong factor. That was a stronger factor than attendance of education and training. And access to education is critical because a doctor who works in rural area in Bangladesh, they have to go to Dhaka. They can't train locally. They have to. So we were very surprised that people value the local connection. So punitive measures by themselves mostly discourage people, but people were happy to trade off. They were happy to accept community monitoring and measure sanctions, but to get the benefits. So they were happy to receive a package that would actually incentivize them. So some of them, we identified groups of doctors that would never stay. They just have too many connections. They just want to leave. But we identified, we sort of subgroups, which these are the type of groups you could work with. You could actually offer them a package of incentives and they can potentially accept it. That's the interesting message, that you can't talk about everybody. You have to target particular groups. So, and of course, you may ask me a question, what does this supportive relationship with community? We were confused. What exactly is that in practice? Is it very kind of vague? But it's not. It's doctors are very often attacked. So very often they need somebody powerful in the local community to go and tell, don't attack this doctor. They just had a poor outcome from the disease and treatment. People don't have accommodation. They need protection. They need somebody who can, if somebody complains or there is a reasonable demand, the only way they to resolve that is somebody powerful in the local community to come and really intervene in the health system. Interestingly, as you know, there are a lot of internationally emphasis on community structures and trying to understand what exactly community structures can do. But we are finding that it's not just community structures, it's people, individual, local elites. So it's really important distinction because that affects how we operate. Just 2 slides. I know I'm close, but I would like to just say something about Nigeria. Very powerful data coming in right now and on behalf of our team in Nigeria. Basically, everybody knows that the people are absent. However, they're often connected to powerful people, and say local government chairman. They can't be reprimanded. Nobody has the power to actually do anything. Although there are regulations in place, there is good governance procedures, everything is there, but you don't do it. That's what people are telling us. Why? Because if you do it, the local government would allocate less money to your health posts. So you don't want to do that. You have to do a trade-off. That's exactly the point. So if you have a complaint, you chose to close your eyes. That's what people are telling us, people who are in these structures, who are actually very unhappy about this. And so the important thing on this slide is absenteeism creates a system where everybody benefits. Everybody has a benefit. Sometimes those who are absent are asked to share the salary. They pay others in order to cover up for them. And then from the beginning, from the day they're employed, somebody calls and says that these are the people who should be exempted from any punishment. They get political support. So the health workers in the local community provide political support to powerful politicians in exchange for protection. This is what we see consistently. And finally, so addressing absenteeism, there are health posts, there are procedures, there are complaints mechanism. It's actually very good the way it's working, and people are very motivated to address it, but they can't. They have to tread the fine line. I already explained that. But importantly, there are different types of networks. Nigeria has always had a kinship network, but what we see in recent years is a shift to political networks. So these kinship networks are not as strong, actually. You need to have the political protection of powerful individuals. You may ask me, my final slide, what works? Has something worked? And I would probably say not much, but we have isolated cases which we would like to follow up in further research. For example, there were death threats against somebody who tried to impose sanctions against absent people, head of department. However, they got community together, they did complaints, petitions, and there were a few separate cases, as you see. There were donors intervening, and so alliances, collective action. There was somebody from the diaspora who intervened and said, if you don't have people here working, we're not going to donate drugs. So these are minor anecdotal, but really this is where we are. And my final slide is this. If we want to address absenteeism, we need to think about beyond the health system. We can't stay in the health system. We need to think about the local government, what is happening, the other political drivers. But we also need to think about informal solutions, because what people told us, if you have complained and you try to resolve it formally, it doesn't work. But if you try to get everybody in a room, all these powerful actors, less powerful actors, you may, and there are cases of they reaching solutions. So I would like to stop here.
Thank you, Lina. Thank you very much. Very interesting analysis of absenteeism and how it does, or in fact doesn't, I think is the key lesson, get resolved. I'd be really interested to, think more about how the political settlement at the local level shapes the capacities for complaints resolution, as you point out, a mixture of informal, taking into account the very powerful informal political structures at the local level is really crucial here. So thank you very much for those fantastic presentations. I think we've had such an incredible wealth of insights here. I am going to open it up to the Q&A, and we do already have a few questions. I'd like you all to please add your questions or comments, if you like, into the chat box. So we have one from Ariel Frisanjo, which is that SDGs and national indicators for governance seem to ignore the importance of government's accountability and redress mechanisms. So which strategies do you suggest for global civil society to advocate better on this issue of government's accountability and redress mechanisms? Let's take this to say that Ariel is wondering how we can get accountability and redress mechanisms taken more seriously as part of the SDGs for governance. That would be SDG 17, 16, 17, I think. And who would like to pick that one up? Who has any thoughts about whether accountability and redress mechanisms should be part of the SDGs? You can.
Sure, I can talk about it.
I'd like to go with that. Hello? Sorry, somebody was speaking there. Tom,
that was Tom.
You take that one, Tom.
Yeah, sure. It strikes me that a lot of the interest from the people that have engaged, people like me and Annette, is a dual purpose with GRMs and accountability systems. It's as much about understanding what's going on with their services and responding to citizens as it is about another way of doing monitoring and evaluation and being accountable to their funders and donors. So I think if you can frame a lot of this as a way that governments can be more efficient and donor organizations can track how, can monitor and evaluate the projects and services they're doing, but have like citizens doing the monitoring and evaluation, that might be more attractive. And that might be a way to actually make, I guess, make citizen-led accountability and monitoring almost an indicator in itself, like how much of governance is monitored by citizens and how in a sense. So I think it's a framing thing as much as anything else, that there's a fear of duty bearers that they're being monitored, but if you can like reframe it, that actually it gives them a way to monitor how the money that they're and the promises and the stuff that they're doing is being spent. Yeah, so if you see this as an influencing problem like that, I think there's something to go along with there, because you quite often don't, with all the talks of rights and all the rest of it, you quite often don't see that donors underneath the surface are using these things as an M&E mechanism as much as they are as an accountability.
Yeah, thanks, Tom. I mean, I also wonder to what extent we have to rely on donors to drive these changes. In a growing number of countries, donors are not as important as they once were, and perhaps this is more the case in the humanitarian development nexus, as you put it, that they do matter. But thank you for that. And I'm going to, and thank you, Ariel, as well, for that great question. And I'm going to hand to Suchi now to answer Gilbert Muyumbu's question, which is, for the GRMs, are there thematic variations, for instance, health versus water service provision, or geographic dynamics? And how does state capacity really affect GRMs, the ability of governments to introduce and actually make them work? And then he's got a third question, but we'll just go with those two for now. So Suchi, why don't you take that one now?
Sure. Thank you, Gilbert. I think, yes, we did find in our review, there were thematic variations. And in fact, the water sector is one of the areas where we did find, at least in South Asia and in Kenya, the Maji voice, particularly in Kenya, where municipal water sector boards or water sector agencies were able to institute largely digital technology-based complaint systems. And they were somewhat successful, at least in the Maji voice case. There was more universal success across different classes of citizens, which was not the case in the South Asian India example, where we found that there was like a democratic deficit, particularly in informal settlements or slums, where water service delivery is not formalized because of the nature of the slum residents' relationship in terms of receiving services, because they're not considered legal residents, to use a state nomenclature. But we did find that in the water sector we also did find that in social protection programs, again, a lot of evidence from South Asia, a lot of evidence from India, Bangladesh, and Pakistan, where there were both project level as well as national program level GRMs that were working. In some cases, they were not official grievance redress mechanisms. They were more accountability mechanisms. So in the India case, it was social audits, which are not considered formal GRMs. But in the case of India, they are starting to do a lot of problem solving on very crucial aspects of the employment guarantee scheme, which is helping them access job cards that would entitle them to work, as well as helping them get their wages, which might be getting stuck not because there is because of corruption, but because of a technical glitch, which is a biometric information not matching on the ground. On the second question of state capacity, we've been the more and more we're reading and the more we're discussing amongst ourselves, this question of state capacity keeps coming up. And in terms of capacity, I would urge everyone to think not in terms of like resources, like not money and more people, but also in terms of the reform mindedness. We know that higher levels of the state, of governments, might be more inclined to instituting and establishing reform measures like grievance redress mechanisms, but that reform mindedness and that willingness we're finding that it's not shared in the same way. So in other words, GRMs might be interpreted differently by different parts of the state, right? And if you look at the frontline aspect of it, it's the people on the front line, the officials on the front line that are at the receiving end of GRMs. And if they are not sufficiently, if they don't have sufficient power for redressal or for redirection of complaints, then they're going to feel overburdened and they're going to get disgruntled. And that is going to surface in their response to the complaint bearer, not necessarily to the official who's above them, even though they might be disgruntled because of the downward centralized focus of most GRMs. So
thanks, Suchi. Yeah, I wanted to, because Marta Schaef has also asked a question which raises this complication of state capacity to respond in response to Dina's discussion of absenteeism and how hard it is to address given the deep rootedness in informal politics. So she was wondering if Isaac or Annette perhaps might have some thoughts on these dynamics that Dina's talking about, the informal politics. Isaac or Annette, would anyone like to talk about that, to talk about the question of state capacity to respond, picking up where Suchi has been taking us?
Isaac, please go ahead first.
Whoever's ready.
Okay, I'll go first. I think just bring the dimension that state capacity in terms of management and arrangement of political demands and issues came out very important. But one thing I noticed is that one of the drivers of change and subsequent service delivery is all politics is local, so that the people, localized politics played an important role as a motivator and a driver for change. The community members were not playing to the national political issues or trending political issues. They were dealing with local politics, and they were able to use local politics and as a space for power negotiation, as a space for resource negotiation and resource reallocation, and that was a motivator and driver. Bottom line, all politics is local.
That's great. Annette, any additional thoughts on the question of state capacity?
Yeah, I completely agree with you there, Isaac. And I think this is something we saw less in South Sudan because of the duty bearers being different in that case. But in Pakistan, Tom and I had also worked on a grievance redress system there that I think really highlighted the role of informal politics and local elites and them playing. I think Suchi's written about this in some of her research. The way local elites and interlocutors can play that interlocutor role, because this also goes back to what Suchi was talking about, anonymity, and we saw this hugely in South Sudan, where people's fear of making a complaint and retribution should their anonymity not be kept, and the way in which they will look to those who have always delivered for them, and this is hugely something in Pakistan and India that I've seen come up a lot. If you know, the local elite has always been able to resolve things for a community, they will continue to be the people that people go to. So if a grievance redress system or complaint system doesn't factor those dynamics in, you're bypassing, and those people may be problematic. It's not to say that's a good way for people to be complaining, but it comes back to the who are we to say who someone ought to complain to. But whether they're the right people or not, whether there are patriarchal and hierarchical dynamics and marginalization dynamics that come with those local elites, they're a presence, they're a fact. If you try and ignore them and set up a parallel system that doesn't in some way factor them in, your system is going to bypass the way in which people are comfortable complaining. So I think one of the things that I really learned through this process that we worked on with South Sudan is having multiple ways and multiple avenues for people to be able to complain to is so important, because then you open up the platforms through which people can, and maybe over time people start to find that one platform is quote unquote fairer or less problematic, and in which case maybe they shift that. But if you don't keep the way in which they are comfortable complaining or already, if that does exist there, and that is always driven, I think, by local politics, then, and informal politics, then you're really going to have big problems in the system. And I think that's really important.
Yeah, no, that's great, thank you. And I think those local, bringing out those local political dynamics and what it is possible to complain about and how it is possible to get resolution, absolutely crucial in how we think about GRM design and evaluation. For Derek, Amy Panilla and Sano Magenzi Elaine have questions about your local monitors, how the local monitors were selected in the work you're talking about. And to that, I would like to also attach some part of Colin Anderson's question about the individualization of GRMs and the necessity or otherwise in your experience of collective forms of feedback and complaints registration. So Derek?
Thank you. Yes, so there's a few ones to run through here. I'll try to answer from Integrity Action's perspective. Obviously, many approaches are out there. And indeed, we have various partnerships that involve some kind of citizen monitoring, and even they vary. But generally speaking, how are local monitors selected? So generally, they are, as you suggest, Amy, people who are already quite civically minded and indeed have an active interest in the thing being monitored, like the health centre, for example, like the infrastructure project, which will really make a difference to their lives if it is indeed successfully completed. But they might be nominated in the community, they might volunteer, they might be recommended. All of that is kind of figured out in a very context-specific way. Are they paid? Again, it varies. So there's a project we just completed in Tanzania with Rally Tanzania, where the vast majority of monitors weren't. And we were very interested to see that the level of retention across the 3 years of the program was really quite high. It was getting on for 70% of the monitors stayed with the program for 3 years. But in other cases, they are paid, for example, their travel expenses, because sometimes in a rural area, they might have to travel quite long distances to get to the thing they are monitoring. How do you keep the motivation level up? So there's a few things to mention there. So I mentioned earlier that monitors identify problems and then get solutions. And that solution finding process can be quite a big motivator in itself. And that's where these kind of quick wins come in. So although like small localized problems that might not make a massive difference to the performance of the thing being monitored, but they are quite a good spur if they can get that solution to then spur on kind of more motivation to solve the rather more tricky and systemic problems that exist. But there's also other things around collective action, which obviously Colin has asked about. Also, technology is an interesting motivator. Citizens are often quite motivated to take part when there's the opportunity to use a piece of technology and to learn about how to use that and what kind of data it offers and so on. And there's also the recognition within the community. Sano had asked about the level of capacity building and training for monitors. So yes, just quickly, they are trained typically partly on things like using a device if they've never used one before, a digital device, but also on things like constructive problem solving, on negotiation, on what their rights and entitlements are, some of the things that Isaac mentioned as being so important. And then on that point about collective action, I think that's a really, really interesting one. That's definitely like a core part of how Integrity Action and our partners have approached a lot of this stuff, about how monitors, when working together, firstly have the benefit of a lot of different views. So when there's, for example, a gender mix in that group, when somebody with a disability is in that group, they can bring more insights to what might be going wrong with a project. If just a simple example, if a ramp isn't being constructed to provide access to people who need that kind of access to the building, someone with a disability may well be much better at spotting that sooner than somebody without. So all of this stuff, I think, is really, really important. But we can't forget that there are sometimes really sensitive issues that people might want to raise on an individual basis. Our monitoring doesn't tend to go there. That's not the kind of thing we're looking at most of the time. It's more to do with kind of contracted and written down and codified entitlements that people have and whether they're being delivered. But I think we can't forget that that does play its role too. There you go. Yeah. 3 questions.
Thank you.
One.
Yeah, thank you, Derek. You did a marvelous job with that. And I would urge anyone who's interested to know more about how the citizen monitors work and the integrity action work to have a look at the really excellent research, look at their website for more detail on that. We have one question here from, I'm sorry, I've lost it now. From, where's it gone? Chris Owala, who asks, how can we connect accountability to people's pain before gain? Chris Owala is asking this. While the panelists are thinking about what that might mean and how to answer that, I will also add to your list, and any of the panelists, I think, Dina, you haven't had a chance yet, so if you'd like to answer this, you're also most welcome to take this one up. Jonathan Fox asks, who can see what are the problems reported and where they are? What kind of problems, the patterns of complaints, and who decides whether claims are considered resolved? So in the complaint systems that you were looking at with regard to absenteeism, what are you finding there? Any of the others, the panelists, also welcome to respond to that.
I would like to respond to the question about the big scale programs to look at, to analyze patterns. I think we really need to do that because there are a lot of, what we've seen is there are a lot of initiatives that work really well with a lot of support, but actually when you try to integrate it into a bigger system, it's not always sustainable. There are examples from Indonesia where they established a national complaint system. It's one of the biggest one. And in Malawi, citizen data hubs where people can collectively submit huge amounts of claims, and we're getting access to that. So that will be interesting. I just want to make one single point that I think the only way to deal with this in the health sector with complaints is to make a clear plan of what will be done with the information, who benefits from this being resolved, how can you collect people who are powerful, who have interest of addressing this. Because otherwise instituting a model of complaints without having a clear pathway to impact, it's actually damaging because it damages public trust. So that's, I think very often we have donors and people jumping in with great ideas and it actually works. We have a lot of cases, it works. People submit very active helplines, all sorts of models, but it doesn't really resolve. And that's the problem. There are always people who are stopping it. We can't not address this problem. And I think through some sort of community mapping or power mapping analysis, we need to almost preempt before we start. So that's that from me. Thank you.
Oops, forgot to unmute yourself. Thank you. That's really great, Lena. I really like that answer. It's really interesting to hear what you're going to be doing next in your work as well. We're going to start wrapping up now, so I'm going to give each of the panelists 1 minute, and Tom and Annette, you each get 1 minute. But I'm going to give you 1 minute. So any last questions you want to answer, any final points you want to make, you can start now. Your hand was up, Tom, so you go first. You're going to have to unmute yourself, though.
I'm going to try and answer the pain before gain question. In the places I've been involved in GRMs, there's always quite a lot of pain at the start because GRMs can seem a fearful thing to duty bearers. And I think a lot of that pain either comes from a lack of understanding of what they are, what they're for, or the GRM getting the politics wrong. And I can't tell you exactly how to get from pain to gain, but I do tend to find, or at least the work me and Net have been involved in, once people see an episode or an instance of responsive governance, Whether that leads to something actually changing or rather just a better understanding of service provision and duty bearers and everyone's obligations and challenges, you do tend to see an uptake and a snowball of these things. So that's how I try and address the pain before gain, if that's what you meant.
Nice, cheerful thought. Thank you, Tom. Annette, your 1 minute.
Thank you very much. I'll use mine to speak to the last part of Jonathan's question there. Who decides whether claims are considered resolved? I think this is something that Tom and I had really long discussions with our partners in South Sudan around. And we talked a lot about what we call the closing the feedback loop of not just, is something resolved, but have the people who made the complaints in the first place, the individual or the community, been told about what's happened to it. And we were emphasizing over and over again about how important that is, because if people don't believe in the system, they don't trust in the system, they're not going to use it anymore. And you could have, the best resolution system ever, but if no one's going to use it, what's the point? But I think there's an issue there that we encountered with our partners that we talked about a lot of what is considered resolution. And, in an ideal world, it'd be lovely to say, well, only the person who complains gets to say whether something is resolved or not. But we all know that there are situations, and, we've had many of them where someone will say, I want X. In Pakistan, it was, we want every health facility to have an ultrasound machine because people thought ultrasound machines were so fun and cool. And I agree, they're really interesting, but it just wasn't practical. It also wasn't necessary. And so the people who'd asked for that would never consider that to be resolved. But, is that then unresolved? So Tom and I were talking with our partners a lot about saying resolution can be more than just the thing that was complained about is fixed. It can also be that the community or the people have had it explained to them why something couldn't be fixed. And there may be very good reasons for that. There was a flood, the medicines couldn't get there. We're really sorry, it's just not possible this month. Now, it doesn't make the person's life any better, but it in that moment, but it does do what's so important for grievance, stress, and social accountability overall, and creates that two-way communication of saying, here's why the thing you wanted and that we didn't do for you didn't happen. We're really sorry, and we're going to try and do better. And that can mean a huge amount to people who have, like all of us, been used to just getting a black box at the end of our complaint and not hearing what's going on with it.
Right.
So I think that to me is it.
Yeah, answerability ultimately. You may not get the clinic or the ambulance or whatever, but at least you understand why that's not currently possible. That's great. Thank you. Now, Isaac, would you like to have your 1 minute to wrap up? And let's keep,
sure.
Unlike some of us have been doing.
Sure, I'll take 1 minute. Basically, by parting shots, people always know what they want, when they want it, how they want it, and with whom they want it. And I think there's an emergent space for discussing development and reconciling the role of representative democracy vis-a-vis open governance. And it's an area that international development workers like myself or researchers need to begin to pay more attention, close attention, how we make open governance work within the context of community level and within, if you like, rights-based approach to the same. Thank you.
Thank you, Isaac. Yeah, important words there. And Derek, would you like to have a minute to wrap up? We're very just at the end really now.
Sure. Why don't I do the bits of Jonathan Fox's question that Annette didn't do? So he's asked about the data and who would see it and so on. So basically, the data that we collect through citizen monitoring, the kind of idea is that stuff is public, basically, and some of it is made public on a website. But of course, there's a couple of problems. Firstly, not everybody has access to the internet in the places where we're talking about. Secondly, they may not want to look at our site anyway. They might have other things to do. And thirdly, there is just so much data that we're collecting. And actually, we found it quite challenging to work out, well, what do we then present? So tackling all these problems is interesting. But I think one of the key things is around what does public display and sharing of complaint resolution and these kind of key statistics mean? What does it look like in different kinds of environments with different levels of connectivity? And how can that add as an extra incentive to the kind of problem solving and responsiveness that we want to see?
Thank you. That's fantastic. Dina, your last minute, your last word?
I think I had it before. I just want to ask everybody to say that I posted a link to a new group that we created. It's part of Health Systems Global. It's really there to continue this type of conversations, and we'll have a lot of opportunity. I just want to make one point. A lot of what we talked about is working within the state structures, within the systems. I would argue that we need to go beyond that. We need to capture the informality. We need to capture the problem solving of people, especially in places where the state institutions are very weak. Otherwise, we are not going to start with the state very often. This doesn't mean the private sector. This means non-governmental, but also local authorities. And we were thinking in terms of solutions, we want to go and crowdsource solutions. So that's part of our next steps, but please join the group. You don't have to pay anything. It's connected to Health Systems Global, but it's not part of the registration fee. And there'll be a lot of events there. So thank you very much.
That's great. Thank you so much, Dina. And I hope you can all see the link in the chat. So join that group if you're interested to do more. Now, Suchi, I think you are our last speaker to have the very last word.
Yeah, I would just take the last minute to address the question that Annette raised, and we weren't able to address it. And her question really was like, when you're dealing with actors or power holders who are not public agents, how can you ensure that they are likewise empowered to address resolution and respond? And here I would just say that whether it is donors, bilateral institutions, national governments, when you are designing or establishing a GRM, it might be very clear. It might be very useful for you to think about what you hope to achieve from a GRM, because unless you treat this as something that is going to address real issues, practical issues on the ground, both for state actors and providers and program officers and the program beneficiaries, then you can actually get somewhere. You can start to think of a system that would actually work and be functional. But if you're going to only treat this as something ornamental, something that will look pretty on paper, then you're not going to get very far. And then we're going to have a paper GRM that looks great, but in practice, it'll be non-existent.
Yes, I think this is an important lesson from what we've seen in our literature review as well. And we've had a fantastic participants. Thank you very much for your excellent questions. I'm sorry we couldn't answer them all. A big thank you from Integrity Action and the Accountability Research Centre. And you can sign up for our updates. I think, Isabel, you're going to stick the sign up details there. So please sign up for the ARC newsletter and for the research and other events by Integrity Action. And please stay in touch afterwards. It was a real pleasure to hear from everyone here. And go and do some complaining. Lovely to see you all. Thank you.